Good morning. I'm very pleased to join the 2022 Asia Pacific Regional Virtual Conference on ECD. On behalf of the Technical Working Group of the 2030 Countdown on ECD, I would like to thank the organizer of this conference for giving me the opportunity to talk about monitoring ECD in Asia and the Pacific. In my presentation, I would like to first share with you some basic information about the Countdown to 2030 ECD country profiles. These are important resources that combine over a couple of pages all the available data on ECD across countries in the world. In the second part of my presentation, I would like to share with you a very quick statistical overview of how children are faring with respect to a selection of ECD indicators for Asia and the Pacific. Let me start by talking about the ECD country profiles. These profiles have been put together by a technical working group that includes distinguished experts, starting from Linda Richter, who is the chair of this group. The group has been working over the last 5 years to put together this important resource. The country profiles are produced by UNICEF for the technical working group. UNICEF is responsible for data compilation, editing, design, and production of these profiles. But these profiles are a common good. They have been developed by using the nurturing care framework as the underpinning conceptual and monitoring framework that has been guiding the selection of the indicators and the data that are presented in this profile. As you know, the nurturing care framework includes 5 important components: good health, adequate nutrition, security and safety, early learning, and responsive caregiving. The nurturing care framework also recognizes the importance of facilitating environments for all of these components. And the nurturing care framework is closely connected with other important international frameworks, including the Sustainable Development Goals. The ECD country profiles present data across 42 indicators that are part of the nurturing care framework, some of which are also Sustainable Development Goals indicators. In particular, each country profile includes 4 indicators related to the demographic context of the country. There are then 8 indicators related to threats to ECD. There are indicators across the 5 components of the nurturing care framework. Each country profile presents indicators on health, and we have 4 of them. The country profile also includes data for 3 indicators related to nutrition, 4 indicators related to security and safety, 4 indicators related to early learning. Unfortunately, we do not have currently data in the ECD country profiles related to responsive caregiving because we are currently lacking indicators and measurement tools for this area of work. The ECD country profiles also include information about policies and international conventions. These country profiles are made possible thanks to the increased availability and quality of data related to ECD. This increase in the availability and quality of data on ECD has mainly been due to the inclusion of ECD-related modules into household survey programs, such as UNICEF-supported multiple indicator cluster surveys and USA-supported demographic and health surveys. And these 2 survey programs represent main data sources for ECD and more broadly for the well-being of children across the world and are extensively used in the country profiles. The country profiles, however, also include other types of household surveys and censuses. They include model estimates, and country-level data published in high-impact journals. The profiles are accompanied by metadata, information, and annexes, where you will be able to find all the definitions and the data sources for each one of the 42 indicators. Over the years, we have been producing this country profile for a larger number of countries. In the first edition of the profiles in 2018, we were only able to produce such profiles for 91 low and middle income countries. In 2019, we increased the number of country profiles from 91 to 138. And in the 2020 edition of the ECD profiles, we have been able to add 63 high-income countries. As of today, the ECD country profiles are available for 197 countries, and they're available in multiple languages, including Spanish, French, English, Russian, and Arabic. So, what can we learn from the data that are included in this country profile, specifically for Asia and the Pacific? First of all, I would like to share with you an overview of the data availability for the region across a selection of the indicators that are used in the ECD country profiles. This slide shows the proportions of countries in Asia and the Pacific without comparable data on ECD indicators. And as you can see, for certain indicators, such as those related to inadequate supervision, treatment of HIV for pregnant women, minimum acceptable diet, early stimulation and responsive care, availability of books in the home, and positive discipline, unfortunately, as of today, we are for most of the countries in the region. Now, on the basis of the available data, however, there is already a lot that we can learn. First of all, nearly half of all children under the age of 5 in the world live in the 41 countries in Asia and the Pacific. This is the equivalent of 320 million children. Now, if we look at the population of children under 5 in the region historically, and we look also at the projection to 2050, what we can learn is that while Asia and the Pacific are seen as declining population of children under the age of 5 in the last few decades, the region will still be the one with the largest number of children under 5 in 2050. Let me share with you now 10 key facts on early childhood development indicators for this region. First of all, in 15 countries in the region, 2 out of 3 young children experience violent discipline by caregiver. Less than 50% of infants under the age of 6 months are exclusively breastfed. Less than 75% of young children in half of the country receive early stimulation at home. 1 in 3 women did not receive appropriate postnatal care in the region. At least 10% of young children receive inadequate supervision at home in 7 of the 10 countries with available data. Another key fact, attendance in early childhood education is less than 50% in the region. Around 80% of children under 5 in the region have had their birth registered. 1 in 4 children under 5 with symptoms of acute respiratory infection did not receive advice or treatment. Half of the country in the region do not have some form of paid paternity leave. And the last key fact that I wanted to share with you is the following. Nearly 1 in 4 children under 5 are stunted in Asia and the Pacific. There is clearly much more that we can learn from this ECD country profile for this region and for the world. So we really would like to encourage you to look at the profile and make use of these public goods for promoting policy and action aimed at improving the well-being of children under 5 in the world. And these are the websites where you're going to be able to find the country profile. I hope you found this presentation useful, and I wish you a very interesting and successful conference. Thank you.